Okay. So if we want to, I can pull up the themes again on this. Would that be helpful? I see Heather nodding. And if we'd like to, we can just maybe go through each one in turn and see what comments and thoughts folks have. We'll, as I mentioned, we're recording this, and so we'll be able to take all of your feedback and incorporate it into the development of the report itself. And then, as you know, you'll have more time, a couple of weeks, to actually comb through the themes and provide more feedback before the actual report, draft report, gets released. So let me see if I can share my screen with the Zoom. I'm sorry, with the, okay. Apologies, I have to pull up the, okay. The themes, okay, let's see. Okay. Do we want to say anything just generally about the presentation? Happy to have any conversation that's helpful to you all, or would it be most helpful to go into the themes one by one?
Well, I have a general comment to make. I'm a little concerned that enough outreach hasn't been done to providers. And I am hoping that there will be more opportunities for that to happen. I think getting 15 survey responses from crisis providers across the state is pretty inadequate. And surveys, providers are so inundated with surveys right now that I feel like if I had more information about the outreach that was happening, I could have sort of let you guys know that probably wouldn't be the best way to collect some data and kind of come up with some other ways. There wasn't a community forum that was structured just for providers. And so having those, one-on-one interviews with payers is great and essential and important, but they're not the ones providing services on the ground. And I think they would appreciate some more opportunity to talk about the things that are working in their communities, and not just sort of the gaps and the barriers. We'd like to have a comprehensive assessment of both.
Great. So your feedback, Joan, would be that we find ways to talk with providers more deeply than
Yes.
ways that we have so to date. Okay.
Correct. Thanks, Betsy.
Yeah, absolutely. Yeah, this is what we're all about, trying to figure out where we can dig deeper and get more information, and as we go forward. So other folks?
I have a kind of piggyback on that, which is not directly related, but it's about the subcommittee recruitment and how that is only being done by email. Like there are attachments, but there's not really anywhere online I can steer people. And I'm just bringing it up now because it seems like it's another kind of oversight, maybe in an outreach situation where the communities who are being reached out to aren't necessarily being considered.
So Puck, can you say more about that?
If we're trying to recruit people with lived experience or people who haven't engaged in kind of policymaking communities, I probably don't have the email address for most of the people that I know and work with at this point. Like the kids these days, I'm not one of them, but a lot of them don't necessarily work from an email basis. Like they have apps and whatnot, but communication through email isn't really a thing that they do. So I'm going to email Jamie later too with more specific feedback on that thing. But really what I'm trying to point to here is I heard Joan talk about people being inundated with surveys. And so I can see how that would easily be missed. And I feel like that's kind of similar to not having a way for me to try to recruit people that is actually relevant to their communities. So just kind of a general thing.
other ways of communicating with potential participants for subcommittees specifically, Puck?
Just in general, I think we're really rooted in I feel like bureaucratic is the only word for it, really rooted in coming from a state perspective of how we're doing things and how we're communicating. And maybe that's not what's going to work at this moment.
Yeah, and if you communicate with Jamie and also maybe send some feedback to the public comment or the email address with ideas of, outreach, that would be great. Other thoughts, just generally, observations? Okay, and we can go back to general thoughts and observations as well. So a few questions then for discussion. What are your initial impressions of the key themes? Are they comprehensive enough? Did any of the themes surprise you, and why? And then we can, kind of go into the themes themselves.
Can you put the slide up that has the list of all 9?
Yep.
Great.
Yeah.
And I assume these are listed and just sort of generally they're not prioritized and
Not
in any way.
prioritized.
Okay.
No. And these were based on, again, and this is, I think, your point, Joan, that these are comments from the key stakeholders that we talked about, kind of the provision of service responsibility folks. And then with also, we're incorporating thoughts from the forums that we held.
I was a little surprised, and I don't know if we're going to go one by one, but especially in the technology, looking through the detail and stuff, it feels like we're doing you have 988, you have the 3 hubs, break, you have the regional AESOs, and I'm not as familiar with this, but there seems to be, if this is, the way I understood the whole thing was 988 and the regional crisis said this was all supposed to be one system, and I know it is, but it doesn't look like, because it says nothing about 988, technology connection. And then in 911, and again, I'm biased since I'm the 911 coordinator, but it's not mentioned anywhere in here. And any dispatch of law enforcement or anything like that, or EMS, is coming from 911. 911 has to be a part of that. But it just seems like there's 2 systems right now. They're talking about the hubs and then the regional centers, and then 911 somewhere else. Where if this is going to be a success, this has to all be just one system. All 3 have to be one system. We have to talk to them as one system and how they're integrated and interoperable. So again, just something I saw, but I'm probably a little more tuned into that than everyone else.
No, fantastic feedback. Yeah, it's so where's 911 basically, Adam? You're saying there's
where's 911 and where's like 988 when we discuss in the technology section says nothing, I don't see the connection to, so.
Yes, and I think Mark mentioned that we're waiting for some pretty critical information, and there's Michelle. So Michelle, maybe you can speak to that.
Well, I mean, I think, how do we fit in that? That's not what I was going to speak to, but it does make me think like the conversation we just had, and I know we did that, but like, I think we have to ground and maybe be clear in what are the parts of the system and maybe their current responsibilities. And then, we are moving towards that, hopefully, because if different parts of the system have different responsibilities, that should be blind to the people we're serving, right? Or they shouldn't have to worry about that. But I do feel like we're not all coming to the table with core common understanding of that. And then what we're trying to move towards, which is really like one point of coming in like no wrong door and then triaging behind the scenes to get people the services they need, which to me then also leads to at some point How do we understand where the right follow-up and all the different pieces is, and is there criteria about whether it belongs, you know, with crisis response, or it is just a call as the person they need, or when do we hand off, you know, the criteria for handing off behind the scenes to 911 or some of those pieces. So that's just kind of, I think, like, how can we use the assessment to ground people in the current landscape? So, and then you're right, I think where you were gonna go. So I guess I could stop there because
No, go ahead. Go ahead. I think you're going where I was going to go.
You were mentioning, so we do need to get some information, and I know everything's happening so quickly, and this timeline was short, which is why I can really understand, like, this is a living document and it's the beginning of our process together. So I think we all do have to remember that, because there's a lot of work to do to get to what we, you know, what we all want as our end stage. But we need to get more information from the Department of Health, which I think now has just started coming in. But we do, I think we shared call volumes and stuff with you before, so staff were going to get it to me before. But we do have to be clear about, there's a lot of different crisis hotlines in the state. And that's one of the goals of this, right, is to make it seamless to people to access those types of services, and then get them to, like I said before, to the right place. Because there will be, I mean, will be a need to triage, and you know, even though the National Prevention Suicide Hotlines may answer it, that may not be, or very often not going to be, the endpoint. And that gets to the need of technology too. Like how can we share information seamlessly and do those handoffs? I was also going to say onto another one, but I'm into the person, family, and thinking about some of the stuff Puck was saying. I think really resonates with me as well, because this keeps coming up, and about how do we serve people in the ways, because I think it's not just how are we collecting information, and it fits to kind of what Joan was saying, but then how are we truly going to serve people? Because some people may want that. Some people may pick up a phone, they may text, they may want somebody that they can help them through a chat or something. I don't know. I just think there's a lot we need to learn about, especially if a lot of the first time people are entering services. And we heard that a lot from the personal stories we had today, which is our young people trying to you know, that there a lot of times the first time somebody's in crisis is at a fairly young age, and our two stories highlighted that. And they're not going to search on the web for a phone number or all these different things, and they're very probably unlikely to call a phone number too. So what do we need to do? And to be able to serve people in a way that's going to resonate for them.
So one of my observations, I was listening to Mark's presentation, and then the comments around how we have not surveyed broadly enough. And I hear you, Joan, and Adam, you talking about the 911 system. What we have focused mostly on is the funding of the current crisis system. And also, the delineation for the crisis system around DOH, HCA, and how funds flow. And so I think the piece that, pulling forward around, 911 is one of those critical feeders. So we need to represent 911 as part of the current state. And that, I think, is, that's contextual. It's for us to be able to say, if we're creating the handoffs, and if we're thinking about how calls get to 988, which is, something that's still not live, how are we going to, how do we represent that in the current state assessment so that we can, do the work going forward? And then also, I heard from Kim Hendrickson in a chat around, how we're defining the collaboratives, like the work that's happening isn't just funded necessarily through, HCA or DOH. There are community collaboratives as well, and that will be represented in that collaborative section. But I think there's, more to come about all that good work. And Joan, to your point a little bit, all the work that's happening in community, where are we going to start talking about that as best practice and things to flow forward? It may not be represented fully in the report. There may be just examples, but then we have to start talking about where are those pockets of excellence and what's happening in community that, that we're really proud of, because we certainly don't want that to be lost in this. So Adam, you had a hand up, or
Yeah, I was just going to say that we talk a lot about, is this a 911 call or is this a 988 call or is this a regional? And I think we need to get away from speaking that because it's going to be integrated because there are going to be 911 calls that we're going to want to pass off to 988 or vice versa. And we're going to need to keep the other one on the line. There may be someone, someone standing on a bridge or something and needing someone to talk them down. But you'll still need law enforcement or someone to show up. And so there's going to be a lot of dual calls where 911 is on the line dispatching while 988 is talking to them. And same thing with the follow-up and the local, I get my terminology, BHASOs, the local
The lines,
or regional
yes.
ones, who we already work with. And so I just think it's important because I had a discussion with HCA earlier today and we were talking about, they said that some consultant said that 95% of the calls don't require dispatch of some kind of team. But I think that's going to change, especially depending on how we advertise this. Because if it's advertised as 988 as the suicide hotline number or something like that, I could see that being. But what we're trying to do in this state, which I completely applaud, is we're trying to expand the mental behavioral health crisis system. So if this is advertised as a crisis hotline, the call volume is going to increase, and a lot of those calls are going to have to be moved to 911. They're going to get a lot of "I'm in crisis," whatever that crisis is. So that I feel like I'm just always on the soapbox talking about this, but it should be one system, and the citizen needing this should think that if I pick up 988 or 911 or the 1-800 number to the Kitsap County, behavioral health crisis, I'm talking to the same people. I'm talking to it's unfortunate, the government. I'm talking to, one entity, and it should be seamless to them. Sorry, I'll step down off my soapbox.
Well, it speaks to all the technology that we need to, right? And the seamlessness and how we're going to figure out all of those component parts. Right.
And in addition to technology, the processes, they should get the same kind of care and call from a 911 telecommunicator as they do from a crisis hotline telecommunicator. Should be the same, and it should sound the same. I mean, that's one of the goals we have in 911 here is that statewide, whether you're in Garfield County or you're in King County, when you call 911, it gets answered and you get the same service, an equity of service. You're going to hear the same thing. It's not going to be different. So, and I think it should be the same way here. Obviously, we get it to the right people, but yeah.
And you're speaking to future state.
Yes, and to some degree current state, because right now we're delivering calls to the Suicide Hotline Center and we're talking to the local regional, crisis centers as it is now. So streamlining it, I guess.
Yeah, it really, I'm thinking about the importance of the subcommittee work and how we're thinking about staging and phasing and what has to happen first, right? When we launch this line, and then how do we support service availability and access and streamlining, right? All those things have to be figured out. It just speaks to me. There's so much about what, the assessment report is the canvas, and then the work really happens as we, try to understand what we're taking forward, but what we need to create and how we do that work is going to be so important. So, I've been really focused on, for the assessment report, making sure that our themes are comprehensive enough, that we're describing enough about kind of, the frame to then be able to dig in and say, okay, how do we enable those things that need to happen? So yeah, just understanding that, to Michelle's point a little bit ago, we're not going to have, the comprehensive assessment is only going to take us so far. And then we have to, really leverage that into the conversations that we're having starting in 2022. So other thoughts about things that we're missing in terms of the key themes? I've heard a lot about, you know, how we're including communities and the various, you know, providers, members with lived experience who, you know, maybe don't know how to engage with this process, our 911 folks, you know, making sure that we are aware of the resources, you know, various and sundry in the community to pull on. What else is missing here? Themes, or if we want to go to any of the sub themes. Again, because this becomes the basis for, you know, digging into and trying to represent that, you know, the current state.
One suggestion I would make, it's touched on, I think, in one of the sub themes, about how we sort of have this over reliance on deep end crisis services. And, you know, it's probably not a key theme because we are talking about the crisis response system, but to have something in the introduction of the report or something like that that acknowledges that we need a strong, stable outpatient behavioral health system that can provide early intervention and preventative services. Yeah. The stories we heard today about young kids and adolescents needing crisis services, the goal should be to help them sooner before they ever need to call 988. And I think it would be important for us to sort of keep that sort of overarching goal in mind as we do this work. That we don't want 14-year-olds calling 988. We want to be able to help them before they get to that point whenever possible.
Yeah, there are comments trying to, maybe it's under the person-centered theme. Sorry, just where we talked about preventative services.
I actually think it might be under 4.
4, okay.
If I wrote my notes down right.
Let me see here. No, that's financing.
But the top.
At the top?
Mm-hmm. Total financing appears disproportionately balanced. Yeah.
Yeah. Oh, and
so I mean, I do think that could be framed in another way as opposed to just financing and, you know, make it more person-centered.
Yeah. Yeah, there was that person, community, family-centered section as well, but it doesn't, and yeah, that's what I was trying to find. Here we are. But your point, Joan, really that, you know, upstream prevention is the best person, family, and centered, you know, community-centered approach, and that the over-reliance on those crisis services, the more restrictive services, that's kind of an after the fact. If we funded the outpatient behavioral health system, for example, funded some of these services, warm lines and prevention, then we would be much more, I think that would get to those person-centered approaches.
You said that beautifully. Thanks, Betsy.
Trying to reflect the conversation. Puck?
Yeah, I've been thinking about a barrier that I see people face in reaching out to crisis services. One big one is, oh, I'm not in enough crisis to need help. Like, it's a crisis to me, but I don't want to take services away from other people. And also just like fear that crisis, as it would apparently in Greater Columbia region, fear that if you reach out to crisis supports, you're going to be involuntarily committed. This is a weird brainstorm that I don't know if it would work, but what if, it's so hard because 988 is specified as a crisis line, but what if, like, we have warm lines, what if it wasn't necessarily always marketed as a crisis line? What if we focused on 211 connecting people to services to get mental health supports. And we also, I don't know if we have some kind of like psych service program referral beyond 211, but like, what if our mental health hotline is more a broader thing than it is necessarily just marketed as you are in crisis, call us.
Mm-hmm.
Because for me, like I've lived here a year, I still haven't found a therapist that will work like with my brain. I've been looking actively, but it's, I don't know. I feel like for so many people, even just trying to get into those preventative services is such a barrier on its own.
I think that's a really good point to keep in mind as we think about sort of the 988 public awareness campaign, because certainly from where I sit, I was thinking of this line as being very broad, that someone, you know, a mother could call 988 and say, I need a place to stay tonight. I mean, that is very much a crisis. You know, or someone who needs help accessing a food bank. Like I have been envisioning 988 as being sort of a very broad connection point to different services. And I like that brainstorming idea of trying to market it in a way that that everyone should be comfortable calling and finding out whether or not you think this is an important enough crisis for you to take up someone's time, you know, to make sure that it's marketed as really that lifeline of support.
Comfortable, I think, is a really strong word from that.
Where are folks going at this point with your thoughts?
I have some thoughts on theme 7 around the workforce, which also kind of tie into that 5.1 of the services rendered.
Mm-hmm.
I worked as a employment specialist, and I watched my caseload just get piled on, and I watched myself try to do my best, but because I was overloaded, I couldn't provide the amount of support that was needed. And I think that there's really something to be taken into account about like the organizations that we're funding to deal with these things, and making sure that profit isn't the only incentive, because I've seen a lot of social service response from people around social services to be like, oh yeah, I tried that place and they didn't call back. Or like my grandfather was just involuntarily committed and then was released to a facility, and then they took them out of the facility and he's back at home and there's nobody following up with them. Like there's nothing in the system to check up a week after, 2 weeks after. And I think there are some caseworkers who would do that if they had time, but they don't have time because of funding. And like it comes down to the organization and how they manage their staff. But in capitalism, we have an incentive to try to streamline and give our workers as much work, more work than they can do. And I think that's really harmful on the ground.
Yes, the workforce issue is a big theme across all of our, you know, behavioral health and crisis services system. Joan, I know you can appreciate that. In terms of so I want to go back up to the high level, and just in terms of the structure of the themes and what we're driving towards. Do you all have any thoughts about, you know, the report development itself? Or, I mean, I thought it was very helpful to hear just kind of pockets of where you're seeing gaps. So maybe it's not the themes per se, but maybe the way that information is being represented, or little checks and balances. I thought it was helpful to hear about 911, helpful to hear about community, helpful to hear about providers, and kind of making sure that we are pulling forward things that are happening in various communities. And we have 10 minutes left in the breakout room, evidently. So any other just structural kind of comments, or, even you guys got this wrong and you really need to think about a place to go? So
I guess, Betsy, I'll just say that I think, again, like everybody's looking to see themselves in it or see where they're coming from. And I think you're going to have to make it really clear at the beginning that this is like, which I know this isn't the report, but like maybe that needs to go out, that this is like a starting place.
Yeah.
We have more community input. We have more processes to go through, because and it's current status, right? So that's kind of a piece, and probably even when you send this out for feedback, to make that clear as well.
Yes, that is really helpful. And I said that at steering committee, Michelle, but I think really just reiterating that this is a moment in time snapshot, and it is not and cannot be, it cannot be inclusive of everything that our system is. I'm definitely hearing, this 911 piece, Adam, something absolutely, that's a critical feeder. And 988 isn't represented at this point, but will be in terms of projections and, that's a critical piece about our future state, where we're going, that we'll know enough about to represent in this report. But there are a lot of things that won't, and elements that need to be described and included and considered in, the go forward that won't be represented here. So I think that kind of framing will be important. Otherwise, I mean, I'm getting the sense today that there's a lot of, I'm not here, right? And I appreciate that folks will not see themselves in every, in a lot of detail, mostly here again, and just to be able to frame what this is intended to be and what it can't be at this point in time. So that's helpful. Puck?
Yeah, in terms of that aspect of it, I had two things that I was looking for that I didn't see. One is I appreciated the list of some, like the crisis response for my area was listed, but I would love to see a list of the various organizations that are being discussed for each region. And then I don't want more to read, but contextualizing these things might be helpful with some pop-up or sidebar, like something that's clear that it's not the main thing and you can skip it if you want, but for more additional information, here's a tiny blurb where someone gives their example of what this is talking about. So if we're talking about, person and community-centered approaches, then there are a couple of people talking about their stories of successes or not successes in trying to do those things. We have providers talking about barriers that they face and stuff like that.
Got it. I wonder for each of these sections as well, if a little bit of the context that we provide would be around, this is what we considered. And this was what was in scope in terms of our, I think I'm just going to the last point that I was trying to make. We're looking at the system and the way the system is funded currently, and what we need to consider is all the ways that the system is supported outside of, the state structures. And you know, that will enable us to really represent the, you know, both the nuances and the, you know, the special aspects of the system that perhaps the comprehensive assessment doesn't lend itself to.
Is this two different conversations that you're trying to have in one document? One about the funding and one about the system as a whole?
Well, I think the way that we've been thinking about this is because the system is about the funding. I mean, the funding is driving a lot of the resource that is either coming into this, well, that's coming into the system. But there's a whole bunch of stuff that's around the system that isn't about the way the system is funded. That, I mean, there are alternative mechanisms for services to be provided. Some community funding, some, you know, partnerships that are happening outside of just the Medicaid or non-Medicaid funding, right? And that we need somehow to be able to, and maybe it's just to say, this report doesn't address that. And that's the work that will address that next year, to think about like the comprehensive system. Yeah. I'm talking as I'm thinking and talking at the same time, Puck. So thinking about ways that we can represent work going forward that isn't necessarily represented in this report. Well, we probably only have a couple of minutes, so we'll come back into the full group, do some wrap up, and then we'll look forward to more of your thoughts and comments if you all, you know, would be willing to offer, you know, more reflections so that we can make sure that we're capturing everything in writing would be great. Heather, I don't want to call you out, but just you've been very quiet. Want to make sure that if you had something to offer, you had a chance to.
I think the only piece that really resonated with me was what Adam was saying as far as getting the same type of, I guess, information, for lack of a better word, from the different places they're calling. I come from a veteran perspective and know that when they call the suicide prevention hotline, the feedback I get is not good. It's that, one, it's not necessarily veteran specific advice or information they're getting in return if someone answers at all. At times people don't even answer. So I just want to make sure that the assessments that they're receiving or evaluations are meaningful and thoughtful. But I think, you know, everyone who's spoken here, you know, agrees with the same thing. I want it to be consistent and a place that they can go, that they know, and a place that we as providers can give out, knowing that they're going to get the best care possible. I hate giving out the suicide prevention hotline information, even though we have to, because they don't get great care there. So that's kind of that's the piece that resonated the most with me.
Mm-hmm. And that's an improvement to the current system that we need to think about in terms of the competency of response.
Yeah, I guess I missed a part. Would this system replace our current? To me, it would make the most sense that it would replace what we currently have and only have one place that people would go to. Is that not going to happen?
So I think that's what we have to figure out. We've got the 3 Lifeline call centers currently, and those would be maintained. That's the idea. And I'm looking at now, right? We have the suicide prevention hotlines. Those lines, I think, will be the call center hubs going forward. And then there's the question of all those crisis lines that are in communities.
Okay.
How, you know, what the disposition of those crisis lines is and how we make sure that we're connecting And that's work, that's future work as well.